I'm Andrew Little, I'm the Minister of Health amongst other things, and one of the main things I'm doing at the moment is leading a big reform, a change process for our health system to try and modernise it and provide better health services.
大家好，我是工党国会议员陈奈斯，今天很开心可以跟我们的卫生部部长，当然他还有其他很多的头衔的 Honorable Andrew Little 可以跟大家一起来分享一下我们工党和部长现在所在纽西兰的医疗体系当中所做的改革。
I think one of the main things I expect to see is greater consistency across our hospital network. So with 20 DHBs, it's every hospital has been quite separate from each other, and each hospital does the best they can with what they've got. But if a patient might get better care in another hospital because of the very special nature of their health condition, it's a very convoluted process for them to get that care. With a nationwide system, they won't have those barriers, and their doctor or their specialist will be able to say, you know what, we can do that at our local hospital, or actually we can do that at a hospital in a different town or city that will give you the care that you need. The other thing we know we have to improve on is equity of access to healthcare. So we know that there are some population groups who struggle to get healthcare, Māori and Pacific in particular. And so with the Māori Health Authority and with some of the additional resourcing that we've provided, what I really want to see is much greater improvement in access to healthcare services for those population groups. I mean, the health system is always facing challenges. We know that one of the challenges we've got here, for example, in cancer treatments, we had a recent report that said that the available cancer treatments in New Zealand are less than what is available in, for example, Australia or the United Kingdom or Canada. And so it's my expectation with the additional money we've put into PharmAC, our drug buying agency, is that we can actually broaden the number of cancer treatments and reduce that treatment gap that is between New Zealand and other countries similar to ours.
Yeah, thank you. So,
我觉得其实我们这一次的医疗改革，主要它其实是把我们20个不同的这个 DHB， 就是我们的卫生局，可以合并成一个国家全国性的 Health New Zealand。所以其实这个会让我们等于说，在我们不管是花销开销当中，就会有更大的一个节省。而且其实更重要是，比如说今天你在一个比较地区化的一个小医院当中，他如果没有办法给你提供这样子的医疗服务，他可以那个医生可以很简单就说那你去隔壁城市的大医院里面，然后这个系统它就是成为全连贯的，而不是每次你越过一个边界的时候，你还要做很多转院的这样子的一个手续。当然我们也知道我们要去针对的是一个平等，就是医疗资源平等分配的一个问题。我们知道比如说一些我们的毛利或太平洋少数族裔，或者一些住在比较偏远地区的人，他们的医疗的资源是非常少的，所以我们作为一个国家可以现在做一个平等的一个分配。当然我们现在看到就是说我们这一次也给了PharmAC，就是我们就是国家买药的这样子的一个单位更多的钱，其实我们已经上升30%了，所以其实能够让他们能够在更快的时间给出来更多更新的药，能够去治疗我们的病人，这也是我们这次在这个预算当中做到的事情。
That's over a 4-year period, and what that reflects is that the system has been underfunded for a long time. So we know that 12 out of the last 13 years, the district health boards collectively have run into deficit. And this year the deficit is expected to be about $500 million. So part of the $11 billion is say, right, we're going to guarantee that $500 million a year for the period from now on. In addition to that, we've increased the funding $1.3 billion this year and added to each future year, and then from next year a further $1.3 billion. That is to meet the cost of growing wages, more positions we need to create, and then just the cost of services. So hard to sort of break it down. The role of Health NZ and the Māori Health Authority is they get the funding. I mean, they're going to be required to deliver a range of services. That's what they're going to be contracted to do, and to make sure when they spend the money is they're delivering those services and improving the range of health services and the number of people who get access to them. So that's what it's going to be targeted at.
对，其实我们你刚才说的，比如说是100个亿的这么大的一个数字，其实它其实是4年当中，所以这样子就是我们就是给这个 Health New Zealand 和我们马上的 Healthy Māori Health Authority 一个更好的一个确信，就是比如说他今年他知道他可以知道未来他可以签4年的一个合约，因为我们知道最近 DHB 就是我们的医管局现在面临的问题，就是我们基本上今年会看到一个5个亿的一个缺损，他们每年他们都是一个花超过预算的一个这样子的情况，所以现在我们能做的就是说他们知道未来他们还有多少钱，所以他们就可以做一个更长久更有效的一个规划了。
I had prostate cancer many years ago, and now I'm clear of it, so that's been very good. But we got a report from the Cancer Control Agency a few weeks ago that said that of the range of cancer treatments available, we're not really doing as well as other countries that we often compare ourselves to. Australia is the classic one, and in some cases, it's not that we're not buying the right drugs, is that we don't authorise particular drugs for the full range of treatments that they could be applied to. In some cases, it does mean getting additional drugs. So we've provided this additional funding to PharmAC. PharmAC's budget will be up around now next year, $1.2 billion a year. That's how much we spend on pharmaceuticals and some other hospital equipment. But I think we have a chance now, if we look at that cancer treatment report, to start closing that gap in terms of treatment. So broadening the use of more drugs, buying new drugs. You know, some of the areas of cancer that we don't do so well in, lung cancer is one of them, is that there are available treatments that we don't currently use in New Zealand. Although I can't tell PharmAC what to do, I have said to them I would like them to work really hard to bring on board more cancer treatments so that we close that gap with other countries.
因为我们上个礼拜收到了一个就是癌症控制协会他们的一个报告，就是说我们平时会跟我们最爱比较的几个国家，澳洲是最一般爱去比的。那其实我们在我们的癌症的治疗和医疗服务里面，其实我们是非常非常的短缺的一个，就是相较之下我们做的不够好。所以这一次等于说我们有了一个这么多的一个 budget boost， 那其实在这个上面，PharmAC他们就有这个权利去能够买更多的，比如说治疗癌症的药物。其实现在我们做，比如说像在肺癌这一方面，我们就做的不够好，我们现在能用的药是非常少的。当然我们作为就是部长也好，或者说政府，其实我们不能够去告诉PharmAC他们要能够做什么，他们是完全独立的。可是当然他们手上资源多了，他们的那个 budget 更高的时候，他们当然就可以去考虑更多的事情。然后当然部长也会去传达他的期待，就是让我们在癌症药物这一方面能够给纽西兰人们更多的这个选择。
Yeah, good. I mean, we've spent quite a bit so far in lifting pay for a lot of health workers. We have an agreement with the nurses organisation, for example, on nurses' pay, but that's sort of met a stumbling block at the moment. We've just done what we call a pay equity deal with the admin and clerical workers in the public health system, and that's all been endorsed. So they will see an increase in pay. We are hopefully about to enter negotiations with what we call the allied health workforce on their pay equity agreements. We're negotiating at the moment with midwives on lifting their pay. So there's a lot going on at the moment to increase pay that's been provided for. Lifting pay will help to attract people into the health services. That will help alleviate some of the problems that we've got. The $76 million workforce development money is, some of it's for existing health workers to help lift their qualifications and broaden the range of work that they do. For some, it's supporting people to take on, people who are not even in the health system, to go to university and get health qualifications, or go to a polytech and get health qualifications. We know, for example, with the vaccination program we did last year, there were a whole bunch of people who had varying levels of experience in the health workforce previously, and we brought them on board, gave them a little bit of extra training so they could do the vaccinations. A lot of them are saying, look, we like working in health, So some of that money will go to providing them with additional training and additional credentials so that they can become health workers. So we're looking for every opportunity we can to grow our health workforce at a whole range of different levels, because there's a lot of work to be done.
其实这次大家看就是我们在各个就是在医疗界内都在做更多能够提高他们薪资的事情，比如说我们的护士，我们的现在支持人，就包括我们的 admin， 就是所有的这些都在做，然后包括我们现在马上也要进入跟助产士的一个谈判过程，当然这都是跟他们的工会有一个谈判，所以都有很繁琐的一个程序。可是这次我觉得最有意思看到就是因为新冠疫情的整个注册疫苗的这个活动，或者说这一次大规模的这样子的一个program， 我们看到很多就是跟医疗相关的人士，我们都把他带进来了，然后他们做了一小点点的培训，然后他们就可以等于说开始注射新冠疫苗。然后他们在这一次的过程当中就发现说，其实我是想要能够让我的事业在医疗行业当中能够继续的发展，所以这次我们提供了在这个预算案当中很多的资金，让他们可以再去upskill， 就是让他们可以再去进一步的去学习。然后当然我们也会把这样子同样的机会提供在已经在我们医疗系统当中服务的人员，然后确保我们有一个医疗的工作系统是他们能够来去 service 我们纽西兰所需要的这个医疗体系。
Yes, I think it will. I think a lot of people want to come and work in New Zealand. I think, as I say, getting the pay issues finalised would be very helpful. But like a lot of people, a lot of Kiwis who are overseas are keen to come back and work in the health system. So they don't have to wait for a residency or anything. But there are a lot of people in other parts of the world who are keen to be here. I know for nurses, we're having a 2-year work requirement before they get residency. Part of that is because we don't just need nurses in our public hospitals, we need them in our aged residential care facilities and our GP clinics. And what we've been finding is that a lot of nurses, they'll take a job in a retirement home or a GP clinic, and then as soon as they get their residency, they go off and work in the public hospital because there is a difference in pay rates. And what the people in the retirement villages and the GP clinics are saying is that, gee, look, we recruit these people and then as soon as they can, they go off to the hospital where the pay is a little bit better. So they wanted some certainty. So the reason why the nurses have a 2-year work requirement before they get residency is so that once they come here to a particular employer, that employer knows they've got them for at least 2 years before they get their residency. And that's why we're still trying to fill all the gaps we've got in the health system generally, because we know there are a lot of vacancies for nurses.
确实，所以我们现在才跟工会现在在很激烈的在进行谈判，就是因为我们确实是想要解决他们现在薪资的这个要求。那我们也现在想要在一直在提高。其实这一次部长给我们护士协会的当时的那个 offer 就被他们拒绝那个 offer， 其实已经是历史上最高的薪资 package 了。所以这个就是一直是我们政府现在对于薪资也好，还是对于医疗体系我们的一个大家可以看到一个承诺吧，就是我们一定会提高。那其实大家看到这一次在比如说绿色名单当中，比如说有护士这个职位，大家就可以看到一个所谓一个很清楚的一个平衡点，就是比如说我们要求护士必须要工作完2年才能拿到他们的永久回头钱。为什么？因为我们知道护士不只是在大医院里面他们的薪资会高一点，所以他们想要在那边有需求。可是同时比如说在我们的家庭医生的诊所里面，在我们一些比如说是老人院当中，我们都需要护士的帮助。那所以其实我们是要现在让我们的移民的这个 setting 能够去帮助到我们现在现有的紧缺，然后可以把资源挪到我们现在最需要的这些领域当中去。
Look, there's probably a level that we can't stop at. New Zealanders have always wanted to travel, particularly younger New Zealanders at the beginning of their career. They get enough experience here, and especially in health, which is kind of universal skills. You can take them anywhere in the world. So people do want to travel, and we often benefit from that. They travel and work for 2 or 3 years overseas, and then come back and they bring back the skills from overseas. So we would never want to stop people travelling. I think the main thing is that as vacancies appear, is that the health authorities are doing everything they can to fill those vacancies.
所以其实在 我们会经常看到，比如他在纽西兰工作几年，有了一些工作经验的时候，尤其在医疗体系，因为医疗体系他们的能力是可以在国家各个地方，他们有很大的门槛出国。我们当然不想停止这样子纽西兰的一个传统，我们也不想阻止他们出国。可是我们想要确保的就是说，当我们在我们自己，比如说现在新的 Health New Zealand 有其他的空缺的时候，我们可以能够去用世界上不同的医疗资源、不同医疗人士，能够去填充这些空隙，才是我们现在想做的事情。
Yeah, so this is part of the health reform process or packages. We want to establish these integrated comprehensive primary care services. So this is, at the moment, one of the things I think we suffer from is we've got GPs, there might be 2 or 3 or 4 GPs in a clinic, and then up the road there might be another 2, 3 or 4, and then across town there'll be some others. What we want to do is join up those primary care services, so having the GP there, but actually and having nurse practitioners who are the very senior nurses, some of them can do prescribing. Also you might have a physiotherapist, you might have a podiatrist, you might have a pharmacist, bringing them all together and getting the best of the professional expertise from all of them. People seldom, when they go to the doctor, they seldom, doctors often have to say, well, I've seen you, now you've got to go and see this person. For a lot of people, if it is a physiotherapist or one of those other health professions, if they are close by or co-located, they can go and see them straight away. Likewise, in rural areas who struggle to get health professionals, we can bring a whole bunch of health professionals together. Then we can kind of distribute that work more evenly, and we might find that people don't necessarily have to go to a GP as the first port of call. If it is, an issue that strained muscle or a strained leg, go to the physiotherapist first, who can do an adequate diagnosis, provide some treatment. So that is about bringing more health professionals together into comprehensive teams to offer a better frontline service to patients, so they're not having to go from one to the other, and often spending a lot of money doing so as they pay the top-up charges.
其实，因为现在大家看到纽西兰的所谓叫 primary health， 就是第一线医疗，它其实是非常非常分散的。有可能在一条街上，你会看到一些理疗师、一些家庭医生，然后还有再有个药局在哪里，所以其实我们现在想要做，就是能够把这些所有的前线一线医疗团队能够全部都放在，或者叫初级医疗团队，全部能够放在一起。然后比如说今天如果你只是一个拉伤的话，你就不用先去看你的家庭医生了，就可以直接去看一个理疗师。所以其实这个是能够让我们的医疗资源能够更有效的被分配。尤其我们知道在比如说一些偏远一点的地区，他们会在这一方面会得到更大的改善的。
I think for people on low incomes, and whether on a benefit or they're working but on a low income, it will make a big difference. So we've increased the grant from $300 to $1,000, and we haven't confined it to a limited number of times in a period of time. It's if you need to go to the dentist and you meet the conditions, then you qualify for the grant. So it does mean people can get the health care that they need, the oral health care that they need. We've always given priority to young people, so we provide dental care for children while they're at school. Once they get to 18, we haven't done much.
因为我们经常在比如说哪怕是急诊室都会看到一些，因为他们没有办法负担得起他们牙医的这个费用，去到了我们的急诊室里面去，然后或者比如说最后造成了感染，所以还要住院等等的。所以其实我觉得这个也是一个防范的一步。
I think with the additional funding in this budget, it means that we've got a better chance of increasing the workforce that we kind of put in place on a temporary basis for Delta and Omicron, but increasing the front line of those health services, so it will make it easier to get access. I think one of the benefits of the Māori Health Authority is through the commissioning decisions that they will now be able to make, is to work with Māori health providers for a population that, for many of whom have struggled to get access to healthcare. That will improve that access, and therefore mean more people will get to see a GP or a nurse practitioner and get the health care that they need.
就是其实我们看到这一次对新闻教会我们很多关于我们的医疗体系，所以其实这一次也会大家看到，就是比如说像我们的毛利医管局，他们就可以能够让他们有这个资源去能够更适合他们提供给他们这个人群的一些医疗服务，能够有最具体的这个提供，所以其实我们看到这个会概括整个我们的医疗体系的。
I think what we can expect to see once Health NZ is formally established on the 1st of July, I mean, they will have the job of making sure they've got a range of plans and strategies across health, including for different population groups. We know, for example, that Waitemata District Health Board has a specific program for health services for Asian populations. It's my expectation that we would pick that up, or Health NZ will pick that up, and will continue that in Waitemata, but actually take what has happened there and take that across the health system. So parts of New Zealand that have reasonably high levels of Asian populations, Chinese, Korean, Indian, whatever, there's the model there that we can take from Waitemata and apply, and I'm pretty sure that Health NZ is thinking about that at the moment.
其实最后我们给完我们的这个预算之后，其实还是主要是 Health NZ 他们要去做我们所有的这个执行，然后他们要去 deliver 这种服务给我们所有的华人社区、亚裔社区也好。可是现在部长也一再又一再的在提醒我，就是说我们非常会有可能我们会看到 Health NZ 现在去延伸我们现在 Waitemata DHB 他们现在有一个叫亚裔健康中心，Waima 大家应该知道是北岸和西区的医管局。那在他们这里面等于说他们会提供一些专门的服务，所以希望 Health NZ 不只是延续了他们现在现有的服务，而是能够用他们现在这个模型，然后能够去运营模式，能够现在把它转换到全国，然后能够去在其他地区也能运用同样的模式去提供给我们亚裔人的服务。
For the Chinese community, they will start to see, I think, better services, more services directed at them, and a health service generally that I think offers the full range of treatments that you'd expect in a country like New Zealand. I think there's real opportunity with the changes that we're making and with the new money we put into the system to really lift the performance. Part of the change is also reaching out to pretty much all the health services and the health practitioners. So including, Chinese practitioners and practitioners of other population groups, and hearing from them about what we can do to improve health services to their communities. I think we'll start to see a lot more of that.
对啊，其实我这次对今年的预算案其实是很兴奋，因为医疗是关乎我们每一个人的，不管你是什么种族或者在什么样子的收入水平。然后有一个更好的一个公费医疗系统，其实是会确保说我们每一个在纽西兰居住的人民，他们能得到他们该得到的这个。可是我们这一次会透过 Health New Zealand 和我们所有改革看到，华人应该会能够接收到更针对于我们和更符合我们一些文化习惯或者一些我们语言能够帮助我们语言障碍的更多这样子的一些医疗的服务。那还有另外一个角度要去看，就是说我们华人其实参与了很多我们的这个整个医疗服务系统当中，就我们是工作人员，我们是医生，所以这一次大家会从 Health New Zealand 包括部长自己的态度当中会看到很大的一个改变，就是我们现在要去听取更多这些多元化的声音，然后让他们来去在主导我们要提供什么样子的照顾给我们的 population 我们的人群才是最合适的。所以其实我们要听取的是更多的是前线工作人员的他们的声音。